Hi, Dr. Diana Haley Rezak, functional medicine physical therapist, here with my webinar on functional medicine and the gut microbiome. So first, a little bit about me. This is me in aerial yoga, something I thoroughly enjoy doing, among other things. But the really remarkable part is 20 years ago, I had severe hip and neck pain from prior injuries, a head injury. I was dizzy, ringing in the ears, constant headaches, difficulty with sleep, just felt awful, and had all kinds of scary diagnoses like Hashimoto's thyroid, hypothyroidism, diabetes, hip osteoarthritis, Meniere's disease. And through my journey, both personally and professionally, into functional medicine, to seek answers for myself as well as my patients, who seem to get a lot better with traditional physical therapy, but not all the time. And I, on this journey, became a doctor of physical therapy after getting my degree in exercise physiology. Then I became board certified in orthopedics, and then board certified in neurology, went into vestibular medicine, also, which is dizziness and balance, and became a fellow in manual therapy, as well as certified strength and conditioning specialist and a golf fitness instructor, all looking to see, okay, how can I correct all these imbalances in my musculoskeletal neuroimmune system? And eventually that brought me to functional medicine. I became a certified functional medicine practitioner. And while all the other things I've done along there help myself and my patients considerably, it wasn't really until seeing beyond the simple organ systems based approach that I really was able to fully heal myself and work with clients for optimal healing. And that's what I want to talk to you about today. So the good part of that story, besides aerial yoga, I don't use a cane. I have no scary diagnoses. I've reversed all my disease processes, and I hike. I even did a 14er last year, and I just feel the healthiest I have in my entire life, and that's what I want to do with you. So first, understanding the types of medicine and what's out there, because there's a lot of different language thrown out, and it's hard to know what is functional medicine. So we start out with conventional medicine, which is also called Western medicine or traditional medicine, which is primarily disease focused. You wait until you have a diagnosis like diabetes or cardiovascular disease, and then we aim to treat it with pharmaceuticals, injections, or surgery generally. Sometimes I might say, okay, well, you need to eat less and exercise more. Well, that's kind of a general recommendation, but that happens. Then there's alternative medicine, which is kind of the complete opposite of conventional medicine, in that it's also called Eastern medicine. It's been around for much, much longer, and really tries to look at things that are closer to nature, like instead of pharmaceuticals, botanicals and herbs and things that naturally occur in our environment to address whatever disease that person has. Not all of these methodologies are exactly scientifically validated, so it's kind of hard to know which of them are right for you and which ones are safe and efficacious. Then there's complementary medicine, which is sort of a hybrid between conventional and alternative. And the providers use both. They use some pharmaceuticals, maybe some surgery, but also look to bring in more botanicals and more closer to nature things, as including nutrition and lifestyle modification. Then there's integrative medicine, which is really a lot more coordinated than complementary medicine, where they really try and say, okay, let's look at botanicals, natural things first, exercise, diet, all that. But they still really focus on the disease process. However, it's more validated research, patient-focused. That brings us to functional medicine. And the one thing that stands out with functional medicine, while we do look at every chance we can to do lifestyle modification of exercise, proper nutrition, botanicals when we need them, herbs, and then using traditional stuff such as surgery and pharmaceuticals as a last resort, we also don't look at a specific disease processes like we do in traditional medicine. We look at the underlying root cause. Why is this person having this, this, and this? What is the underlying factor that can cause all of those things? Not just we treat this separately from this and separately from that. So what is functional medicine? According to the Institute for Functional Medicine is a systems biology versus organ system-based approach. such as musculoskeletal or looking at a whole system. That focuses on identifying and addressing the root cause of disease. Each symptom or differential diagnosis may be one of many contributing to an individual's illness. It examines the interplay of physiology and function and looks at genetics and epigenetics, the factors that change how your genes express themselves, to maximize one's health and wellness, and aims to prevent physical and mental illness. So there's different types of providers in functional medicine. One is a practitioner, and that's the person who has a medical degree and looks at all of the contributing factors, essentially a medical detective, to get to the underlying root cause or causes, and is able to advise that person on specific lifestyle changes, such as what exercise is right for them, which nutrition diet plan is right for them, how much sleep do they need, mindfulness, etc., based on their genetics and biological functioning at the cellular level. And then there's the functional medicine health coach, and that's someone who coaches a person through the process of changes that are recommended by the practitioner, including exploring mindset, values, beliefs, and their levels of readiness to change, and providing them with tools to make these necessary changes. So Dr. Dye's functional medicine PT approach is the combination of a medical practitioner and a health and wellness coach, all in one program. So why are we experiencing more health issues in the United States than we ever have before? We've had almost a 60% increase in obesity in the past 40 years, and we are now the most obese country in the world, twice as obese as number 2. We've had an 80 to 95% increase in autoimmune disorders in the past 30 years, which is now being thought of a form of central sensitization, chronic pain. So why is this? Why are we so sick as a country? Well, you look at our nutrition, it's not adequate. We have more packaged and fast food, it's quick meals on the run, not taking the time to eat our food, digest it properly. And even our sourcing is not as good because of the toxins in our soil and the water, as well as using growth hormones and trying to mass produce food. We have more stress than ever, more demands on the family with both parents working or single parents with kids working, longer work days, taking work home more. There's less extended family usually as families move away and travel more away from their unit, so as well as less community. More kids activities. Kids today are, if you have kiddos, they're involved in every sport and activity, and you're running around, not just time, but energy and financially. Then we have social media and constant input of news and events all the time, which is generally negative, and that just fuels more of our negative stress cycle. We have less activity than we've ever had. Technology makes it great for, washing the dishes and your laundry, as well as computers and cars. So we have a much more sedentary lifestyle than our ancestors had. We have poor sleep hygiene because of a lot of these factors: less activity, more stress, poor nutrition. So we're not sleeping well. It's estimated 40% of Americans today have a sleep disorder, which limits your recovery. If you don't get to that rest, digest, and repair phase every single day, you don't get cellular regeneration and repair, and you get sicker and sicker until you end up with some serious diseases. And then our reliance on pharmaceuticals and surgeries. We have for decades increased writing more pharmaceuticals, passive forms of rectifying illness, or at least ameliorating symptoms and disease. And this is kind of my analogy of putting your check engine light comes on and you just cover it up instead of fixing what's gone. Well, I can't see it anymore. Well, a pill for every ill is just a symptom of amelioration. So you don't know that you have it anymore because the pharmaceutical makes you feel better, but it doesn't actually make you better. So we end up with more disability, infection, and addiction. And then we're compounding this every single generation. So our cortisol levels are increasing. If you had stressed out parents or grandparents, well, that can be inherited through the DNA. Good news is through lifestyle changes that it can also be reversed. And then adverse childhood events. This was a big study done by Kaiser on 19,000 patients. And there's been others that followed. This is just the groundbreaking one that examined how many adverse childhood events, whether it's abuse, neglect, divorce, adoption, childhood bullying. The list is very, very long of things that could be adverse childhood events, and how many of these events and how it relates to your health. And they found just with autoimmune diagnoses, if you had one event, you're 2 times more likely, 2, 4 times, 3, 12 times more likely to have this autoimmune diagnosis. which encompasses hundreds of diagnoses from diabetes to thyroid to chronic fatigue syndromes. And this also went in to look at other diagnoses of poor health, and they found the same thing, that depending on how many adverse childhood events you had, you're more likely to have depression, anxiety, substance abuse, and a lot of other health factors. So it's important that we recognize these in a person and look at the proper treatment for it as well. Combat stress is becoming big. I know I was in the Marine Corps 25 years ago, and if you are in for 4 or 5 years, you might see one tour. Well, now we have not had a conflict break for 25 years. The United States is always in conflict somewhere, and families are sending out their loved ones to not just one combat tour, but multiple with longer stays, and then the families home are without a parent, and there's stress on them too. We have substance abuse on the rise. Opioids became the just end-all be-all pain reliever, and now we have this huge amount of substance abuse and addiction and increased pain related to it, and direct link to heroin addiction, and even as serious as death from that. This is a breakdown of support system. We just have higher divorce rates, blended families. People aren't growing up in the same communities over their life with friends and family nearby. They change jobs more frequently. We just don't have the same sense of community. A lot of our community comes from social media now, which is not always a good thing. And I touched on the opioid epidemic. So the United States, we're leading the pack on that too. I mean, we prescribe more opioids than any other country in the world, and almost twice as much as number 2, which is leading to all kinds of stuff. Cognitive decline like dementia, Alzheimer's, sleep disorders, drowsiness, not having energy, more fatigue, dependence on and increased tolerance to drugs, maybe gum, tooth decay, dry mouth. You can get actually opioid-induced hyperalgesia. So the opioid that's supposed to help with your pain actually can make you more sensitive to pain, as well as, not to mention, the accidental overdose and death. Even when it's prescribed properly and consumed properly, there are a lot of accidental overdoses from opioid use. Breathing and heart problems, constipation, bowel dysfunction, diarrhea, flatulence, low sex hormones, and risk of bone fracture, osteopenia, and osteoporosis. So opioids are definitely not the answer, because they're masking all these underlying things and in fact contributing to having more prevalence of them. So we're making some progress in the United States for sure. There's like the American Diabetes Association, American Heart Association. All these associations for whatever disease are coming out with general recommendations and doing guidelines of exercise and food and lifestyle changes. Like, here's a example of one. You should quit smoking, get rid of your abdominal obesity, lose weight, control your blood pressure, control your diabetes, control your high cholesterol and psychological factors. Well, that's a little daunting. I can't tell you how many of those things I was told to do, and so were many of my patients over the years. And they're like, okay, but I'm not really sure how to do that. I've tried exercising more, I've tried eating better, I've tried this, and they still don't see the results they need. And the other thing is, we're getting better on recommendations for food. We used to have the food pyramid, which was pretty awful. Now we have the food plate, which is much better, but still not quite accurate, because it doesn't tell you specific for you. Do you process carbohydrates better, or do you process fats better? What type of fats do you process better? And same with exercise. What type of exercise is best for you specifically in your genes? So now that we have these general guidelines for the average population, let's look at this. Common means that something occurs often or is prevalent. So autoimmune disorders are common in the United States. Normal means that nothing's out of the ordinary and everything is working well. So you have no underlying issues. The cells are regenerating, they're repairing, they're doing everything they need to. And our guidelines are based on common in a society where almost everybody generally has some illness. So do you really want to be common? And the guidelines are designed on benefiting a significant number of people with that illness. They don't take into account the specific genetics and lifestyle factors, or if that person has multiple things going on. And generally, it's designed to help about 50% of the population with that diagnosis. Most medical research aims to prove that a medicine, pharmaceutical procedure, or injection improves a person's symptoms within a specific illness. And it doesn't examine healthy lifestyle factors or changing the course of the disease progression. It only looks at the symptom. Is it there or not? So each of us has a unique code for our nutritional needs in our DNA. We have a unique code for our activity, including exercise and sleep, and our predisposition to specific diseases. And research and guidelines aims to do the most good for the most people and not right for everyone, because it can't factor in every person's unique code. I kind of look at it as like shopping for jeans. You know, there's really no average. Each one of us has our own unique curves and proportions. No one is a specific size or one size fits all, or even most. Much like our cellular structures, we all have specific needs. Functional medicine is like having a tailor made for your genes or your genes for you with your health and unique personality. This is the illness wellness continuum, and we look at this from the far left being premature death or even death, once you get past that, to the far right being the highest level of wellness with optimal health, 100% function, doing everything you want to be able to do, cells repairing, regenerating, just wellness in general. And if you look at traditional or Western medicine, they aim to get you to that neutral point where you're just not showing symptoms or diagnosable disease. They don't aim to get you well. So only 20% of healthcare dollars paid in the system actually go to health and to get you to be well. The rest is all saving your life, keeping you from chronic disease that will kill you, and symptom amelioration. In functional medicine, we want to get people all the way as far to the right as we can, working on their health awareness, how educating them on exercise and stress and nutrition and all these things, as well as really looking at the mental, emotional health to have optimal cellular repair. I like this quote from Andy Dufresne from the Shawshank Redemption. I guess it comes down to a simple choice, really. Get busy living or get busy dying. I like to get busy living. So here's a question. What are these all a symptom of? Widespread pain, joint stiffness, fatigue, persistent pain, sleep disturbances, depression, mental fatigue or fog, short-term memory loss, mood dysregulation, sensitized GI system, immune function impairments, anxiety, social impact on what you do in work and friends and family, functional impact on being able to carry out your activities of daily living, headaches, sexual dysfunction, hair, skin, nail changes, sinus and allergy symptoms. These are all signs of autoimmune disorders. All of these autoimmune disorders have these symptoms in them. Fibromyalgia, chronic fatigue syndrome, gluten and celiac and non-celiac gluten sensitivity, concussions, adrenal fatigue, irritable bowel syndrome, thyroid, metabolic syndrome, Lyme disease, chronic regional pain syndrome, post-traumatic stress disorder, endometriosis. So what diagnosis do you get? A lot of times it depends on which provider you visited first and where their area of specialty is. Instead of, many people can have multiple of these diagnoses and the same underlying root cause. So how does the functional medicine approach work? In traditional Western medicine, we look at everything as a different branch. Like if you're having gut dysfunction, constipation, diarrhea, gas, bloating, you're going to go to a gastroenterologist. Maybe you're having some skin issues, allergy symptoms with your sinus. You might go to an allergist or a dermatologist. Or maybe you're having some alterations in your thyroid and weight gain, fatigue. You might go to an endocrinologist for a thyroid disorder. So we treat each area of the body separately, and each specialist is skilled in their area, but they really don't communicate a lot with each other. Even those that share reports, they don't necessarily understand, well, this person's having some gut dysbiosis and bacteria and yeast, and so they're having constipation and bloating, but they're also having all these skin and nail and hair issues. Maybe those could be the same origin. Instead of treating them separately, where one person will give a prescription for something and somebody else will give a prescription for something else. So we dive deeper into the trunk and the roots of the tree to look at any imbalances in immune function, inflammation, digestion, oxidative stress, detoxification, hormones, neurotransmitters. And then we look at the physiological processes of the communication, cellular regeneration, elimination of waste, protection, defense, and transport. Genetics, what are you born with? And the epigenetics, how are those genes being expressed with your lifestyle factors? And then that individual's unique attitudes, beliefs, values, experiences, where they are now. So in the functional medicine practice, we first start with a patient timeline, and we take a very detailed patient history based on anything you know about your genetics, your family history around birth, pre-birth, all the way to today, exposures to toxins like lead, mercury, pollutants in the air, life events, illnesses, diseases, any pharmaceutical surgery. And this is constructed in a timeline by Living Matrix, which is a software program I use, to identify critical times. And this can be expanded. I've seen timelines with 10 times as much of this activity on it, where you might see, okay, this person's going along, they're doing fine. Well, then this happened. Well, then all of a sudden they became a little less resilient, less resilient. You see what an explosion of things. So it kind of helps us put together, where did this whole thing start, which is one of the ways we can identify when somebody is on a path to disease 10 or 20 years before they actually develop that disease, and have enough time to turn that disease around so that it doesn't manifest. Or if they already are experiencing it, we can figure out where is the root cause of where it started, and we can help them recover from what disease they're dealing with. Then the software takes all the stuff and puts it into a matrix, antecedents, like what things predispose you, like your family history or your personality type, and did you have any triggering events or traumas? Were there any mediators or perpetrators, exposures, things that happened that helped accelerate what was going on? And then it's all divided into major areas of how your body processes it. And so instead of looking at the musculoskeletal or neuroimmune or system separately, we look at assimilation. How are nutrients being taken in? Defense and repair. How are your cells regenerating and repairing themselves? How is your energy production at the mitochondrial level and the physical level? How are you eliminating toxins and biotransformation? Transport of cells and the communication between those, and communication with your brain, as well as structural integrity. Like, are you having chronic tendon problems or other structures in your body not performing well, liver disease? And we also include the psychosocial realm of your mind, mental attitude, mental focus, emotional and spiritual state, as well as the lifestyle factors of where are you now? How is your sleep and relaxation routine? What kind of exercise and movement are you getting? How are you doing with that? Are you feeling more fatigued after more pain, or are you feeling energized by it? Nutrition and hydration. Are you getting enough hydration? Are you having the right nutrients? Is that food making you feel better, or do you feel worse after certain foods? Stress and resilience, how much stress is going on in your life with work, family, whatever is going on, and how resilient are you to that stress? As well as what relationships and networks you have. Are they working well for you? Are they not? Are they toxic relationships? Then that same Living Matrix program puts it into a little computer graph like you'll see down in the bottom right. And it assembles everything from that patient's history into this matrix and says, okay, this person is having a harder time with defense repair and a harder time with communication. So the larger the point in orange is out to a category, the more of an emphasis that category is. And that helps us connect the dots of, okay, they're having this, 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 and this, and that's all defense and repair. Well, what's their immune function doing? How is their gut healing? Are they getting enough nutrients? So we look at this, and it helps direct us with where to start. Then we can dive deeper with genetic testing. And these tests, there's diet, health, mind, skin, sport, and they tell us what genetically we are predisposed to. Like, do you have this gene or do you not have this gene, and how strong is that gene for you in getting a certain disease or issue? So it tells what we're predisposed to as far as like obesity, diabetes, cancer, cognitive decline, inflammation, any of that stuff, and what level of risk we carry for these, as well as what nutritional, lifestyle factors, exercise, etc., will enhance or suppress these genes. That's called epigenetics. So not only does it tell you you have a gene for this, and this is how strong of an influence it is, it tells you how to best treat that gene to maximize your health. And then we can see whether a person has a high, moderate, or low exercise, whether they tolerance or need, whether they process fats well or not, and what types of fats they process better than others. Do they do well with lactose? Are they better with carbohydrates? Are they better with more protein? Do they tolerate caffeine or alcohol well? And if not, also what their muscle and joint recovery is like to determine the best type of diet and activity for them and their genetic code that they were given. So keep in mind that only 8%, and some scientists potentially say only 2% of our inherited genes contribute to our health. The rest is how we treat those genes with lifestyle factors. So you may be born with a bad set of genes, but by knowing your specific nutritional and activity needs, you can enhance the best expression of those genes. So they say you can be born with really dirty genes and clean them up, or you can have really clean genes and make them really dirty. It's all in how you treat those genes, and knowing exactly what is right for you with your genes is the best way to optimize your health and function. One of the things we look for definitely for underlying inflammation is blood test markers, and these are 5 of the big ones. But a lot of practitioners only look and see, oh, this one's above average, or this one's low, or this one's high. This is a problem. They don't necessarily look at all of your lab tests over time. And as a functional medicine practitioner, we look at any lab test that you've already had done, so we don't have to run them again. But we also look at over the years instead of saying, oh, well, now your A1C is high and you're pre-diabetic. When if you look back at that person's lab tests year after year after year, you might have seen that that A1C was getting a few points higher every year until they become diabetic. And a lot of practitioners don't do anything until it's actually a problem. They don't look at the trends of where your blood markers are going, which is a problem because if you diabetes, oftentimes we can see a trend towards elevated blood glucose 10 or more years before they actually have a diagnosis. And it's a lot easier to turn that around than waiting till you have full-blown diabetes. There's other tests we might order. Some of them are hormones. They look at how your body is converting your estrogens and testosterones and where those estrogens are going. Is it going down a cancer pathway, or is it going down a pathway to Alzheimer's? What about your cortisol level? Is it increasing in the morning when you need more energy and decreasing throughout the day so you sleep well at night, or are you spiking in the afternoon and evening and tired and wired in the middle of the night and then can't sleep during the day and crashing out? We can look at stool tests to see how much good bacteria is in there, and is there any commensal bacteria working with that? What about bad bacteria or yeast? And some people, if they're having a lot of constipation, bloating, those kind of small intestinal bowel overgrowth symptoms, we can look at that. Or we can look at organic acids to know exactly how those neurotransmitters are functioning. The great thing about these tests, not only do they say real time where you are now and how your genes are functioning, it lets us know what to do about it. So for each thing that comes up, it says, well, this person needs more B12 or magnesium or CoQ10. And in the functional medicine world, we first try and say, okay, what's a commonality between all these things? Instead of just saying, oh, you need all these things, we try and see what is common between all your tests and how you function, and then try to get it through foods first and natural sources. Excuse me. So then this is another diagram of functional medicine approach, is the iceberg. We want to identify all the underlying causes of integrating all the genetic and laboratory tests, patient timelines, their matrix, the presentation of how they are now, and then arrive at their underlying root cause. So this is a typical patient where they may have some heart disease, diabetes, pain, fatigue, depression, autoimmune disease, obesity, and maybe even some cancer. And traditionally, they would have gone to like a nutrition person or an exercise physiologist, maybe to an endocrinologist, maybe to a cardiologist or an oncologist for each one of these. Whereas what could be causing all of these could be under the surface of inflammation and hidden infections, digestion and absorption issues, detoxification issues, immune dysfunction, some environmental toxin exposures, poor energy, mitochondrial production, and hormone imbalances. And when we look at these underlying causes and try to decrease the inflammation and improve the cellular mitochondrial function, we address all of the issues on the top of the iceberg. How substances enter our body. Are there bugs in your belly? Yeah, probably. They say the average American is born with 200 toxins in their body at the time of birth. So we're already starting with a negative balance in a lot of ways because of our society today. And then depending on the factors around birth, if you're vaginally birthed versus cesarean, you had better chance of a good microbiome, same with being breastfed. So there's three ways that substances, both nutrients and toxins, can enter our body: through inhalation or breathing, through dermal skin or eye contact, or ingestion, eating or drinking them. And this is the most common route of entry for both your beneficial and your harmful substances. It's estimated to be 85% of our absorption into the body. So this makes looking at the system a good place for good nutrition and potential toxins is an excellent place to start. And that's what we do with functional medicine. So what is gut dysbiosis or leaky gut? Dysbiosis refers to microbial imbalance or a maladaptation inside the body, or more simply, the microorganisms being out of balance. When this happens with the gastrointestinal system, we refer to it as a gut dysbiosis or leaky gut. This usually happens when there's not enough beneficial bacteria and the presence of harmful bacteria and or yeast. So this can manifest as many symptoms, including hormone, thyroid, or adrenal imbalance, constipation, diarrhea, bloating, flatulence, belching, allergies, skin, nasal sinuses, headaches, heart palpitations, impaired reproduction function, fertility, menstrual cycle, libido, autoimmune, chronic pain, fatigue disorders, and leaky brain fog, dementia, Alzheimer's, just to name a few. Many chronic diseases have a leaky gut component. In fact, we speculate that almost all chronic diseases do. The more we understand the gut, the better we can balance our entire body and eliminate these symptoms that we're experiencing. Cells 101, an introduction to microbiology. The super easy clip note version. I promise this won't be too technical. Every single organ in our body, the stomach, heart, hair, thyroid, brain, for just a few examples, is made up of cells. Every cell has the same basic components that you'll see here. And we really only need to know about two of the most important right now. The nucleus, this contains all of your DNA and tells that cell what type of cell to be and how to function. It's specific to each organ and contains the genetic codes for that organ. For example, your liver cells tell your liver to be liver cells and how much energy they need and how they have to clear out anything from the body. Then you have the mitochondria, which is in the bottom right. And this is your powerhouse, or your energy center in a cell that controls how it replicates or regenerates, as well as a planned cellular death called apoptosis, which is every cell in the body is designed to die off at some point and let the new cells take over. This is part of regeneration and repair. It also provides the fuel for all these cells. So each cell has a different number of these depending on how much energy is required for that organ to function. We'll get into that mitochondrial function a little bit more. Mitochondria need your essential nutrients, vitamins, minerals, micronutrients as their fuel source to supply energy to the cells and the organs that they serve. They use this fuel to create new cells on a daily basis, which lends to all of our organs being completely regenerated in 7 years at least once. Many of these get regenerated almost every day. But that's good news, because even if you have been sick for a long time or had a lot of impaired cellular function, once you start giving the nutrients what it needs and getting rid of the stuff it doesn't need, it allows that regeneration to occur, and you can actually look and feel younger than you have in your whole life. Other than probably the certain part of natural course of aging. They also use this fuel to clean out the old cells and remove all the toxins and waste. This is also good news. So you get rid of all this built up stuff from whatever you were exposed to. So when there's a lack of nutrients present and they aren't functioning well with these two jobs, one of two things will happen. Either they won't regenerate or they'll regenerate more slowly due to lack of proper fuel, and this results in premature aging. The second option is they won't die off. That apoptosis we talked about, as they were programmed, and they'll hang around creating cellular alterations in things such as cancer. So what impairs your mitochondrial function? Inflammation is one of huge things, and that can come from several sources. Chronic inflammation comes from too many toxins, not enough nutrients, not enough cellular repair, and hyperglycemia, which is high blood sugar. Can have nutrient deficiencies, either not taking in enough good nutrients or having too many toxins that are stealing those good nutrients. There's a genetic predisposition, but like we said, 8%, maybe only 2% is actually going to show what you're going to express as far as genes and disease. It's how all these other factors contribute to that genetic expression. Normal course of aging, there's a certain amount that none of us will live forever, but I have known some octo and nonagenarians who are at the peak of health and just doing phenomenally, and then others in their teens, 20s, and 30s who can barely function. So age is kind of arbitrary. It's all in how you treat your cells and cellular regeneration to what age you feel. So more your physiological age than your chronological age. Sugar and processed foods damage our DNA, they damage our mitochondria, they contribute to inflammation, they cause a whole host of impairments. They add more toxic exposure, take away from good nutrient absorption. Sedentary lifestyle, we talked about that. That's happening more and more. When we don't move, exercise is our natural detoxifier to improve our lymphatic flow and get rid of everything that's built up in our body that we want to get rid of through our lymphatic system and through sweat. And then there's environmental toxins and radiation, cell phones. All that is building up in our body as our world becomes increasingly more commercialized and more exposures to that. So in some ways we have to work harder than we ever had before to get rid of these toxins. And sleep and stress are a problem for a lot of people, because if you're not getting to that rest, digest, heal, regenerate stage every single day, then you're not healing your cells and your mitochondria are suffering. So the gastrointestinal tract is made up of literally trillions of cells, each with their own mitochondria. Mitochondria are kind of like your bank account. Either you don't have enough positive flow in of the nutrients to support your needs, so you're under-earning if those nutrients aren't balanced, or you're spending all those nutrients on garbage, getting rid of toxins and waste, and not enough left over to cover your essential needs, so you're overspending. Either way, you're nutrient and energy poor, and you're going to have a hard time having good health. What is leaky gut syndrome? So when the cells either don't get the proper nutrients they need, or they have too much toxins in there, the tight junctions, which are those junctions between each cell, loosen up and they open up and they become leaky and inflamed. And then particles enter the bloodstream and the lymphatic system. So it results in a blood-brain barrier breach, resulting in brain fog, mental stuff. Your brain is often called the other gut. Or your gut is called the second brain, however you want to look at it, but they're a direct connection, and you get more inflammation and autoimmunity disorders and more malabsorption and nutrient deficiency, which just becomes a vicious cycle. So you ever say, oh yeah, I had a gut feeling about it, and truth is, everything comes down to the gut. So once the gut becomes leaky, the entire body can be impacted. Your brain, you can have depression, anxiety, ADHD, ADD, brain fog, headaches, difficulty with memory or concentration, cognitive decline, mood regulation disorders. Skin can be acne, rosacea, redness, eczema, psoriasis, cracked and brittle nails and skin. Thyroid, maybe Hashimoto's or hypothyroidism, Graves' disease, hormone imbalances, colon, constipation, diarrhea, gas, flatulence, belching, irritable bowel, non-celiac gluten sensitivity, Crohn's disease, even making celiac disease worse. Adrenals, your fatigue, blood pressure imbalances. Joint and muscles can be rheumatoid, osteoarthritis, fibromyalgia, cervicogenic headaches, joint pain and inflammations, chronic pain syndromes and myalgias. Sinus and mouth may have frequent colds or flus, food sensitivities, allergies, gum, disease. So all of these can be linked to a leaky gut. It affects the entire body. And many of us, myself included, but also many of my patients, have some of all of these, all related to leaky gut. So healthy gut, healthy you. Gut function relies on a healthy balance of your good bacteria to unlock the powerful nutrients in food, as well as getting rid of the waste and not feed the bad bacteria and yeast that are consuming all those good nutrients. We look at the number of and type of beneficial bacteria we have versus the commensal and harmful bacteria and yeast, which helps unlock the root cause of many other symptoms and problems. So with the functional medicine way, we take a look at where you are now. We look at your current lifestyle factors. How's your nutrition, diet? What kind of foods are you eating? How are you responding to those foods? What kind of exercises are you getting in? Are you feeling energized? Do you feel better with exercise? Do you feel worse? What's your mindfulness practice, your spiritual practice? What kind of sleep, psychological factors, depression, anxiety? Level of readiness to change. Is this time for you now, or is there too much else going on? What tools will help you be successful? What are your values, your preferences, your beliefs? And I meet you where you are today and every step of the way through this process. So going back to the real solutions tailored for you. So we work on a specific plan for you. We look at specific nutritional activity and supplements for you to eliminate any bad bacteria or yeast and support good bacterial growth, removing any toxins, reducing inflammation and stress, restoring hormone balances, providing antioxidant support cellular mitochondrial health for regeneration and repair. We find solutions based on your level of readiness and ability to change with your current life demands, personal situation, and your current health. We have regular coaching and education to help you succeed, chock full of tools and resources to make this happen. I work with you and your other medical providers to maximize your results. So Dr. Dye's Optimize Your Endocrine Function, Feel Better 16-Week Jumpstart program. This is a 16-week program of high intensity, working on an individual basis with each person to get their health to an optimal level where they can take it on their own. I'm looking for people wanting to optimize their health, wellness, and recovery, and with a one-on-one medical detective and wellness coach. People who are decisive, ready to make a change now. This is the time. I have had enough of being fatigued, my hair falling out, things not working well, feeling ill, spending time and money on medical treatments and things that don't work. I am ready now to do it. I'm committed. People who are really wanting to work on their health and wellness, not just wait for it to happen. People who are coachable, they're receptive to new ways of things and doing things. People who are resourceful, who are able to be creative with solutions to their problems. And this isn't a do it for you program. It's definitely a do it with you program, every step of the way. So this is a good quote here in this point. Your desire to change must be greater than your desire to stay the same if you want to make a difference. So this is your opportunity to schedule a free consultation with me to see how we can work together to regain your health and optimize your future function wellness. You can message me on Facebook or on my website, drdyfmpt.com, drdYfmpt.com. You can email me at diana.rezac, diana.rezac@rezact.com. And I look forward to chatting with you soon and learning how I can help you achieve your optimal health and wellness. Have a great day.